Okay, we'll get started here. Good morning, everybody. I'm Kevin Cameron, Chief Connector at Connect Delaware and Managing Director at Exclusive Search Connections. I'm delighted to host our webinar this morning, which really is focused on helping all of you managing your organizations through COVID-19, which I think we've heard a little bit about over the last couple of weeks. Obviously, a very fast-changing work environment for all of us, and we're very happy to have sponsors involved in this webinar, including Chemours, Clark Hill Law, Connect Delaware, Newcastle County Chamber of Commerce, and Today Media as well. As I said, our conversation is going to focus on exchanging some of the things that have worked well with our panelists and how they were able to build those programs in place, in some cases over a longer period of time, and in other cases very quickly, as all of us, I think, are focusing on now. At 10 days in, they've also exchanged some of their best practices and things they've seen that have worked well. It is a very fast changing workplace, as we know, and it is something that hopefully we'll all learn some value from and have some new concepts to bring back to our respective workforces. We will have the chat functionality open to all attendees throughout this webinar. We ask that you do enter your questions as you think of them. And we will be bringing those questions to our presenters as we move through the presentation this morning. The goal really is, because of some of the legal components that Molly will be covering, it's important if you do ask a question pertinent to your organization that you're also telling us the size of the organization, because that will change based on the size. I'm pleased to introduce our presenters for today. Susan Kelliher, who is the Chief Human Resource Officer for Chemours. She designs and executes the global people strategy and provides specific oversight for environment, health, and safety as part of the Chemours executive team. There's Susan. And Susan McGarry, who is the Chief Human Resource Officer for Marlette Funding, Delaware's fastest growing fintech company. They have also done quite a bit around technology and engaging their workforce. So we're excited to hear from Susan and things they've been able to do with their workforce. And obviously Molly DiBianca as well, who will be bringing us some information in terms of what to watch for while we're moving more towards a remote workforce on the new normal level, I'll call it, maybe hopefully temporary, but also changes that are happening as a result of legislative happenings in the state and federally as well. We will get started here with the first question I will address to Susan Kelliher and also Susan McGarry. And that would be simply, can you tell us a little bit about how you prepared your organizations for this pandemic?
Well, I'll start. We were in the fortunate position that literally in October of last year, we were reconstituting a crisis support team. Not with an eye to a pandemic, but an eye to any crisis. We operate in a high hazard chemical environment all around the world. And so it's something kind of top of mind for us, this kind of disaster preparedness, if you will. So we charted a team, which I think is probably useful at any company size, that had a leader who had some experience in environment, health, and safety. We had a relevant lead specific to our operations safety, a lead in our health services, which could be, we happen to have some on-site health resources, but could be a contract resource, I'd say. We also included a communications lead who has some experience in crisis communications. And then as needed, we added regional lead resources that really serve to help communicate around the globe around decisions. So first and foremost, it was having a group in place that could develop plans, run traps, execute communication, and also recommend to leadership where we would go. So then by end of January, we were already in crisis planning for the pandemic. We have substantial operations in China, so we knew what we were headed into. We then began using data. That crisis support team, we were quite vigilant about this. We didn't make any decisions around what we did in this pandemic based on what we saw others doing or how we felt or the level of kind of angst that was going on out there. Every decision we made was rooted in guidance from World Health and CDC, period, full stop. And we had a lot of pressure at certain points to, cancel everything, keep everyone at home. And we felt like the prudent course was to manage step by step in lockstep with what the guidance was from the experts. I believe that that allowed us over probably a longer period of time to continue revenue, right? To continue kind of out there in the market, keeping the business vital, while maybe many other companies may have made some different choices.
Thank you. Can we just, I just want to drill a little bit further in that as well, and then move to Susan in terms of her preparedness for Marlette. Can you talk a little bit about the receptiveness of the workforce in this planning? Because I think we're seeing a lot of things coming through where it's either crisis mode or everything's going to be fine. And as an employee, I would imagine, and leading the employees, there's probably a way to balance that you were successful in doing. Can you talk a little bit about that too?
Yeah, sure. So I do again think that we have an advantage because our employee base globally is highly sensitized to safety and to risk mitigation. I mean, we work in chemicals that do pretty scary things. And so that's just a bit of our ethos as a company is to be very aware. So in terms of bringing our employees along, I would say that was the easy thing for us. What we did do, and we have continued to do, is be very present with our employees. So we've made a lot of use of video. We certainly do fixed communication that we post on our website, internal, our intranet. We have materials that we send out via email. We use all those channels. We have leveraged our video capability very highly. So we did a series of videos, myself, the CEO, our COO. We continue to tape videos that then we can deploy. That connection, there's kind of nothing that it substitutes for that. So we're fortunate to have a highly receptive workforce, and we've been highly engaged with them.
Excellent. Okay, thank you. Susan McGarry, can you tell us a little bit about how Marlette has prepared for the pandemic?
Yeah, absolutely. So I'm going to kind of share my screen real quick as well. So one of the things that we've had a lot of learnings and successes with very quickly enabling our entire workforce to change over to 100% work from home. We implemented that on March 12th, so exactly 2 weeks ago today. And just to clarify, this is definitely not a one-size-fits-all approach. What worked with us may not work with everybody. However, we feel there are definitely some consistent themes throughout our approach, which really mirror our culture. And so, we're definitely happy to share them with you so that you can share them with your own organization during this difficult time. We are very focused on our company culture and the personality of it. And it's really guided how we have acted and the decisions that we have made along the way. So I kind of want to frame the way that we've acted in those our cultural values. So the first one really was to collaborate and work as a team. So to take a step back, our preparations did really start a long time ago. One of our best investments during our growth period was to really bring someone on board to our technology and infrastructure team that was dedicated, even though we're a small organization of only 250 or so, that could be set us up to be successful with a very actionable disaster recovery and business continuity plan. And one of those scenarios that we had planned for during that course, obviously, was pandemic response. Ironically, one of the very first simulations that we carried out to test the plan in prior months was for a pandemic response and how we would handle that. In fact, during our fake scenario, we pretended that our chief information officer was unfortunately deceased, and he has never let us live it down. So we've had some good chuckles about that recently. So back in early February, when the media really started carrying more information in regards to COVID-19, We assembled the team quickly. By the third week of February, we had our core team members, and we were officially starting to respond and plan already. Our team, very similar to what Susan just said, included individuals at multiple levels and in different areas of the organization to make sure we were widely covered. Myself and human resources, our operations team, our strategy team, technology and infrastructure, our facilities and project management groups. The majority of our employees, about 95%, are located here in Wilmington, Delaware. However, we do have a small office in Bay Area, California. And so that was the primary concern, given where the first cases were presenting in the United States. And one of the cultural aspects with Marlette that we really pride ourselves on has been flexibility. So most of our organization have already taken advantage of remote work from time to time, at least 1 to 2 days per week. I work myself remotely, 1 day per week here in my home office. However, we do have call center agents on site in our Wilmington office, which we knew that we were going to have to mobilize quickly if we needed to establish a 100% work from home environment. So we knew the organization, let me see if I can pop this over, sorry, was relying on our team to really review, make recommendations, again, as Susan said, based upon government recommendations, the CDC, the World Health Organization, and ensure that we can continue to keep the business and everything running smoothly. So our task force ramped up very quickly our meeting cadence. We began daily calls early on in March, including on the weekends, to closely monitor the situation, the news, all the local reports. We were sharing information across our team almost hourly through a private communication channel that we had set up using a Slack application. So the week before we moved to 100% remote, we actually started rotating, sending entire departments home for at least 1 whole day at a time, so that we could test in real time and ensure that everyone's remote access was working, all of our hardware was working. We had the appropriate bandwidth for our VPN to handle and any network strain that it might create. Our help desk team and tech group have been absolutely amazing. We wound up purchasing over, I believe, 200 additional monitors and docking stations, longer Ethernet cables, and much more, so that our employees who normally just use their laptop when they're working remotely from time to time would be able to have more full functionality at their home and better simulate their current desk setup in the office if and when we pulled the trigger to go 100% remote. So one of our next things is also being very clear and transparent, and we do feel that one of our major ongoing keys to success during this entire time has truly been our open communication practices. We continually updated everyone so that they knew that we were closely monitoring the situation, actively planning, obviously for the worst, but hoping for the best. I think the toughest part with an organization is really crafting very carefully those communications so that we're able to express concern for our employees, the actions that we were taking and recommending, while not inciting panic in the workplace. I think that's very critical. So our early communications really focused on those solid hygiene reminders: wash your hands, stay home if you're sick, avoid touching your face, and so forth. So given the very strong flu season that we had this year as well, we also started to phase out some of the open food items that we would have in the office, such as buffet style lunches and different fresh foods and snacks that we offer to our employees, swapping over instead for more prepackaged, individually wrapped items. We even worked with some of our vendors like Manhattan Bagel to request that they individually wrap bagels before we brought them into the workplace, getting miniature cream cheese tubs instead of putting out the larger cream cheese spreads for everybody. But then really explaining to our employees why we were doing that in an effort to help keep them safe and prevent the spread of any illness, whether it's COVID or the flu or a stomach bug, anything. We typically have a once per week all employee meeting as well to go over business items and updates, keep everyone informed, and we have continued doing just that. So our streaming video technology that we use for meetings is limited to about 125 live streams at a time. So last week, we broadcasted it live for about half of the organization, and then we sent out the recording immediately to the other half. This week, we began doing it live for both halves, just on different days, so that everyone gets the live experience as well. We've also created different web source sites, similar to what Susan said as well, for our employees on our payroll intranet platform. Rather than flooding everybody's inbox with even more items, it feels like every company that you've worked with, that you've purchased something, is sharing what their COVID response has been. And so it's creating a lot of flood in everyone's inbox as well. And so we were very sensitive to that and wanted not to create even more flood with that. Within those resource folders, we've started sharing helpful national links, the State Department of Health links for all the states in which our employees live, since we draw from obviously multiple states in the surrounding area, white papers, the CDC recommendations. We've also created pages, helpful resources and links for caring for children at home and helping with the homeschooling during this crisis. Great articles, tips, resources to help some of our teams learn how to work remotely and how to manage teams remotely, especially when this is brand new to them. So since then, our teams are really settling more into that new normal with a 100% work from home. Although we are in the essential category, since we're a finance organization, according to the governor's proclamation, since we have the ability to work from home and work remotely, we're doing just that. We've identified about 2 to 4 individuals who've been going into the office to make sure critical deliveries are received, such as FedEx and UPS, the US Postal Mail. And if there's any urgent items, they've been sending it directly to our home for us, so that way we can stay on top of business as well. In fact, this past week, we started ordering special surprises and sending them to our employees' children up to age 16 as well, using a great organization called Kiwi Company. It's a monthly subscription service that sends out age-appropriate crates with all sorts of STEM and art and design and geography and early learning activities that's all based upon the child's age. And we're getting ready to send out some special care packages, in fact, to our own employees, hopefully next week, with some fun items to kind of help bring a little bit more levity to their day and let them know that we're thinking of them. We've been very blessed to have a workforce that cares very deeply about our greater community as well. So some of the first questions that we received when we went 100% remote was, well, how can we continue to help support some of the different groups with whom we've worked and what we can do? So we had a subgroup that really went through and kind of mobilized what we could still do for the community. We went through all of our kitchens, gathered any of our unopened pantry items, donated them to the food bank and Bancroft Elementary School, a school that we've been partnering with for several years. The other day, we sent out a communication to our employees, and we allowed them to do a drive-by drop-off of donated food items or to Venmo monetary donations. And those 2 individuals actually went to the grocery store and were able to put together and drop off bag lunches to the Emmanuel Dining Room to feed over 60 people with the donations that we had received just that day. So it's been great as far as, you know, everyone kind of mobilizing. And then lastly, what we've been doing is trying to really continue to celebrate any of our business successes and have fun with our employees. So in order to maintain that business as usual, we've continued with everyday events, such as celebrating employees' birthdays even. Typically, they would come in on their birthday, find a special surprise at their seat and a signed card at their desk. And so we've been surprising them and actually sending it to their homes instead. We really feel that it's the little things to let them know that we still care about them individually as people. It's not just about business continuity and the business continuing to operate and be profitable. Without our amazing employees, we would have no business. So we really want to make sure that they understand how much we appreciate all that they've done and their flexibility during this crisis. We've encouraged them to share pictures of their new workspaces, all their furry friends that are super excited to have everyone at home 100% right now. We started sharing them on our Instagram page. And since we have call center agents that are actually taking remote calls, we've told them and encouraged them, hey, it's okay if you have a dog barking every once in a while when you're on a call. Don't stress about it. It's okay to let the caller know that, hey, in an effort to best support our customers, we're all working from home right now and still handling our customers' inquiries and all their calls. We really felt there was a great opportunity to help connect with our customers in a very personal way. So throughout all of this, we've continued to keep a pulse on our organization through a frequent feedback process, using a weekly short survey program that we've had in place for several years. In addition, we just had a virtual focus group yesterday afternoon where we invited about 1 to 2 members of each department to join us on a virtual roundtable and share feedback from their team in regards to how things are going. What are the new challenges they're facing? How do they feel about the communication cadence that's coming out from our leadership team? The delivery method, how do they want to see it? Do they want it on the website? Would they prefer to have an email so that they're not missing something? So a lot of those types of information. Immediately afterwards, we even created a Slack channel to give people a chance to share tips with how they're handling working remotely and staying connected to one another. So it's been great as far as our employee feedback so far, and those are just some of the pieces that we've been doing to try and keep everyone engaged and pull together kind of as a team for us right now.
Awesome. Thanks so much, Susan, for sharing. It is interesting to see all of us now on video all the time and becoming real people, even through video, and no longer having the ability to do is this going to be audio or is this going to be a video call? I think we all are getting to know each other and our animals and our families and our offices that are at home and all that fun stuff. So it's sort of a refreshing change, I think. As we move into this kind of segment of work, right? Next question for Susan Kelliher. Can you talk to us a little bit about some of the successes, or I guess the top successes that you found in changing over to this new sort of normal, we'll call it, for your workforce?
Yeah. Well, so many of the things that Susan McGarry described are things that we have in place. Some time ago, we went to what we call Flex for Your Day. So we don't have a hours policy. We don't have a where you work policy. We have a principle that we understand that, and we trust that you're going to be effective and productive, and you're going to do so in a way that serves you. So our employees have long flexed where they can. So in our office environment, as soon as we started to hear reports out of China, many of our employees began to exercise their own social distancing, staying home more, working in the office less. We immediately put in place 2 times a day extra sanitation of the workplace. So all flat surfaces were cleaned twice a day. So we put those things in place. I think those were successful. I mean, we've been blessed so far that we've had, out of a global workforce of 7,000 employees, we've had less than a dozen that have experienced COVID-like symptoms and 0 that are diagnosed. And that includes a workforce of about 300 in China. So we consider that quite a good testament to what we've been able to do. That's our office environment. In our plant environment, so, there we don't have the flexibility for people to work from home, certainly. So for them, we implemented a few things, which I think have been really material in keeping our employees healthy and safe, and also just making them feel confident that we'll all get through this. We implemented the sanitation extra again in our plants twice a day. We did that some time ago. we implemented an ABC. So we identified our employees by ABC. Those are C-level. We actually felt that they were non-essential. We could run the operations without them. And we had a trigger point in late February when we sent those folks home with pay. So we had the ability to do that. We, for our employees that remain, that allowed us to do good social distancing. So we've put that in place in all of our plants. So those things I would consider to be quite successes. In order to facilitate those, early on, we developed a special pay policy with an eye towards what we could see coming. And that, for that, we implemented a policy that allowed us to give people 14 days of paid leave if they were quarantined or had a family member who required care who was quarantined. Because most of your short-term disability policies won't cover that, right? And your paid leave policies, if you had them, may have some restrictions on that. So we opened that up. We also guaranteed pay for those C employees that would be sent home without work. When we put that policy in place, we communicated it in video and shared with employees that, hey, we're going to do this as best we can. We're going to evaluate it as this thing goes on because we may need to adjust. And the policy was quite clear to that. Another element to that policy, which I think is important and will be a success as we see the federal and state aid programs starting to be revealed. We set up special pay codes so that we could track all of those hours because we want to be able to report them to recover payroll taxes and to, again, secure any other aid that may be available to us. Those things were really important. So all of the work that we did around cleanliness, social distancing, hours flexibility has helped to keep our employees physically healthy. And all of the things we've done around our pay programs are intended to keep our employees financially healthy. And those are big successes for us.
Excellent. Okay, thank you. Susan McGarry, can you give us your top 3 in terms of the successes that have rolled out through this and things you'd like to share with the smaller business community? So let's call it less than 500 that have worked well for you guys.
Yeah, with us, I think right now our successes still continue to be the fact that we're able to still continue to be as collaborative as we are. We have a lot of different technology platforms that we've set up for communications so that it's not just one place. So people are still being able to meet virtually. They're still being able to get the job done and collaborate on documentation and everything else that they need to through different things such as our Slack, our High Five, our different other channels that they can use. We're definitely, I think the communication piece has been another continued success with us, where we're still continuing to be able to get information to all of our employees and information back from our employees. We've had that great feedback channel already established. And so we're tweaking that now to also ask additional questions in that work from home area to make sure that they're feeling supported and we're able to continue to support them in this new environment, whether it's through May 15th or however long that we're continuing to go. So yeah, we're very excited. We've had some great feedback. In fact, a lot of our employees are excited about the changes that this has brought on because they feel that, hey, we can take a lot of these learnings and continue in some different types of work from home areas that we hadn't thought possible before. So this kind of push into this new environment has really opened up even more avenues for us to continue to collaborate when people are offsite.
It is interesting to see us moving that direction as a society and being able to do things from home very easily. Early on, there was a meme, I think, that somebody said, I guess we're going to see which meetings actually needed to happen and which ones could have been an email, like early on. And so I think now we're seeing I guess we're going to see which meetings have to be meetings and which ones can be webinars or Zoom calls. It's an interesting sort of opportunity to be faster and I think more efficient in many ways based on being able to do things pretty quickly. So thank you for your input as well. I do see we have a question from Heather Krebs, and I'd like to open this up to Susan Kelliher, Susan McGarry, and also Molly as well as we move into the legislation component of the webinar. But Heather's asking, how do you implement some of these policies for a retail company that's considered an essential business where most employees cannot telework? So can you talk a little bit about that?
Well, maybe since I have a lot of employees, in fact, I have, of the 7,000 that we have, in the neighborhood of 4,000 of them don't have an opportunity to telework. They work in a plant environment. They work in an essential business. So as I described, the things that we did to protect them were around creating more frequent sanitation of the areas where they work, and also setting up our schedules and changing things, and in fact reducing the headcount in our plants to facilitate social distancing. So both of those helped. Now, most recently, all of our plants have gone to an external temperature check. So I'm sure Molly will be able to talk about this. So it's relatively controversial because of HIPAA laws, quite rightly, because of data privacy. And so we put in place temperature checks. This is something we'd actually done in Taiwan in the past when they had gone through the bird flu. We have our health professionals or a third-party health provider who is administering with a temperature gun to the forehead every single individual that comes in. And then if they're elevated, they can do an ear temperature check. We have developed with legal a really crisp policy that we feel is an acceptable level of risk. And frankly, what we said to ourselves is, look, what's the bigger risk? That we might face into some sort of a lawsuit around a HIPAA violation, or that we may have 500 people at a plant at risk of COVID-19. And we felt the latter was a far bigger risk. So, and again, our legal folks were really helpful. So that's how we did it in our environment. And I think that is the challenge that a retailer probably wants to think through, is how do you increase the sanitation of your area, maybe protect people as they're coming in, and also then once they're in, creating that social distancing.
Mm-hmm. Excellent, thank you. Molly, can we switch over now to the legal world and jump into maybe initially some guidance around creating a remote workforce, and then getting into the new bill that came in as well. So could you give us some guidance that you would say would be best practices?
Yeah, so, and this is in the slides that I'm going to put up as well, but what Susan Kelliher is talking about is what, the EOC has published new guidance that says, look, you can absolutely take temperature checks when at the beginning of the shift. What, some considerations that you want to be aware of when doing that are, as Susan indicated, who's the person who's doing that. Ideally, you want a healthcare provider to do it. If that's not possible, you want to be very selective in who you're picking, right? Senior management or HR. The other thing you want to do is you want to be very clear about the hygiene, the PPE. You do not want somebody taking a temperature without appropriate personal protective equipment, such as gloves and a face mask, certainly if at all possible. The other thing you don't want to do is you don't want to do it at the front door when everyone's walking in together, because that means everyone is going to see the results. So you want to maintain that privacy by doing each person separately. So maybe some people have had the experience where you get your employer offers a flu shot, and they don't do the flu shot in the middle of the office space, they do it in a little conference room or something, right? So the trick with that, though, is that you don't want to be taking temperatures in the conference room, because if the person's sick, you have just marched them through the workplace. So generally you want to do that right in, at the very beginning of the shift, at the door or the entrance, but not in any place that other employees are going to be able to see it. You also don't want to record that information in the employee's personnel file. And if you get a positive temperature, a fever of 100, I will say the CDC says it's 100.4. The Delaware Public Health Department has said it's 99.4. So, check whatever state you're in, make sure you're looking at the Department of Public Health advisement on this. So you want to be careful about, you don't write it down, and you can also ask a questionnaire, basically. You can ask every employee at the beginning of every questionnaire, of every shift, a questionnaire, and basically the questionnaire is going to be, do you have any respiratory symptoms like cough, fever, chills? And Department of Labor puts, or I'm sorry, the Department of Public Health puts this out and gives you a questionnaire, and so does the EEOC. Do you have any of those symptoms? If yes, is there a known cause, such as asthma, for example, right? Do they know why they're experiencing that? If there is a known cause, then you want to say to yourself, you have to weigh the pros and cons, the risks and benefits, just like Susan Kelliher was saying. You have to assess, what's the risk for our workforce. And if they say, no, there's no known cause, there's no source that I know of, I don't have asthma or anything like that, there's no reason I'm experiencing chills and a fever, then you need to turn them around and send them home. And that's probably where the paid leave comes in too. So actually, I'll jump into that. I'm going to share my screen. A couple of disclaimers, of course. Just really quick, I should say, this is not legal advice and all those important disclaimers, but many of you on the phone I already know, and you can all call me with questions, but I'm certainly not giving you any legal advice at this moment. So hopefully, can you see my screen?
Not yet.
No, okay, hold on. There we go. Newbie, sorry.
There it is.
There we go. Okay. All right. So, if I can go forward. All right. So here's the new law. Everyone wants to know about it. It is extraordinarily detailed and yet so vague because we are waiting on the regulations from the Department of Labor, which we'd like to get sometime soon. The law takes effect April 1st, so I suspect that we are going to get it right at the last minute. So what I'm giving you as far as overview today of the new law, the paid leave law, please understand that there are still holes that we're trying to fill in. I don't know all the answers, and I will tell you which parts we don't know yet, but it is an ever evolving thing. So what I'm doing is giving you is what we know as of this date. And I will say the Department of Labor has published guidance. They put out new guidance yesterday as well. So I'm operating off of that. In other words, it changes every sort of couple of days, but here's what we've got. It's got two types of paid leave that relate to COVID-19. The first type is paid emergency sick leave, so I'll just call that paid sick leave. And then the second part is basically emergency FMLA. So those employers who are over 50 in size are familiar with the FMLA. Those of you who are not over 50 employees and have not yet had the fun experience of dealing with FMLA, and I say that entirely sarcastically, there's no such fun thing. If you have not yet had that experience, you are about to join the club. The law has a sunset provision that it ends automatically on December 31st, 2020, unless it is extended by legislation. So there is a time frame on it, but it takes effect April 1st. Who is covered? All of the public sector. I don't know if we have any public sector on the phone, but private sector with fewer than 500 employees. Now, how do you count your employees? If you are curious to know, you've got, it's only going to be the United States. So domestically, if you have international employees, that does not count. And it's going to be counted from the first day of leave. Why does that matter? It matters very much because a lot of people are laying people off right now. So the two Susans on the phone have had a blessed experience, and it makes me feel wonderful to hear their positive experiences, because that's not the world that I've been living in the past 2 weeks. Many of my clients are having to do mass layoffs. And so when do you count 500? It counts the day the person's going to take the leave. So that number can be a little, we'll call it fluctuating. Now, small businesses under 50 employees. Traditionally, as I said, you wouldn't be covered by the FMLA, but you are now, although the Department of Labor has the ability to give exemptions for 50 employers of 50 or fewer employees. What is the exemption? Here is a big I don't know. Okay, what we do know is that you will have to be able to prove that your business, by giving the paid leave, complying with the new law, this is the quote, would jeopardize the viability of the business as a going concern. Now, what does that mean? I don't know, and you don't know. No one knows at this point except for the Department of Labor, and they might know. The Department of Labor has to define that in their regulations, and the IRS and the Department of Labor have both said that the Department of Labor will give us clear and concise criteria. So we are eagerly awaiting what the clear and concise criteria is. But keep in mind, we don't have that criteria. We don't know what an exemption is. So if you have under 50 employees, do not assume that this bill is not going to apply to you. So I'm going to go through both parts. I'm going to do the sick leave, the paid sick leave first, and I'm just going to call it paid sick leave because emergency paid sick leave is a bit long. So what the paid sick leave provides is that eligible employees get up to 2 weeks of paid leave for qualified reasons. All employees are covered. So if you hired them yesterday, they are covered by this part of the law. Healthcare providers and first responders can be exempted. Now, I put that into quotation marks for a reason, because we don't know what is going to be the definition of a healthcare provider, and we don't know the definition of a first responder yet. We'll have to wait for the regulations for that. Traditionally, under the FMLA, healthcare providers is a very limited and very defined term. So generally, doctors, right? So if we assume that it's doctors and nurses for this purpose, so under the traditional FMLA, nurses would not be covered, but let's just assume that common sense prevails and that nurses would be covered as a healthcare provider. If that's the case, if you have a nursing home, for example, you can tell your healthcare provider employees, however that ends up being defined, but they're providing healthcare. Look, doctors and nurses, we need you to stay. We cannot have you take the paid leave. But that does not mean we have the ability to exempt the cafeteria workers that are providing the food for the residents of the nursing home. So it is a very fine line. This is another one I'm going to flag for you that we just don't know yet at this point what the definition of a healthcare provider is. But what has been misunderstood about this provision of the law is that people see those words, healthcare providers and first responders, and go, oh, I'm a healthcare provider employer, thus I'm exempt. It is not by the employer, it is by the employee. So does the employee qualify as a healthcare provider or a first responder? Those are the ones that can be exempted, but not the entirety of the workplace.
Okay.
Yep. So there are 6 reasons that employees can qualify for this leave. And which reason they fall under will dictate how much they get paid. So there's not numbers here, but the first one is the employee, him or herself, is being subject to a legal quarantine or isolation order. This is one of the areas we don't yet know, okay? Because I've talked to something in excess of 90 employment lawyers this past 2 weeks across the country, and all of us agree on one thing is we don't know what this first one means. Because does it mean right now in Delaware, we are operating under a legal isolation order from the government, aren't we? Aren't we being told by the governor that we have to self-isolate, we can't go out in public? So there is a huge question mark for employment lawyers across the country to know what this first line constitutes, because if it means that the state of Delaware shut it down, closed us for business, does that mean that every employee who was sent home because they can't, we're non-essential employers, gets the 2 weeks of leave, gets the paid leave? We don't know. I'm sorry to say. We are waiting to hear from the Department of Labor. The second one is obviously the employee has been himself or herself been told by a healthcare professional to stay home. So where you're going to get that is you're going to get that with employees who have immunosuppressant issues, if they have underlying conditions that make them a high-risk population, if their wife is home because she's recovering from breast cancer or undergoing breast cancer treatment. That's a person who their healthcare provider is likely going to tell them to stay home and self-quarantine. So that's a second reason for the leave. The third reason for the leave is I have a fever, I have chills, I need to go get tested. Obviously, you don't want them in the workplace. You want them out of the workplace. So that's going to be why you're going to see someone is going to qualify for leave if they are symptomatic. Now, as an employment lawyer and employer side lawyer, I will certainly say I acknowledge that this can be used in lots of ways, right? So an employee can absolutely say that they don't feel comfortable coming to work, and that they tell you that their healthcare provider has told them to say so. So it is going to be a lot of people. I don't want to underestimate the number of people who will qualify, even in those first three categories. Then we expand it to the fourth and fifth categories. The fourth is I'm caring for someone who's at home. So, for example, if the husband his wife is home undergoing breast cancer treatment, he is going to fall into this category. He's caring for a person described in reasons 1 or 2. And then the big one for sure is the fifth reason, which is the employee himself or herself is caring for their son or daughter who's home from school because school's closed, or because their daycare is closed, or because their child care provider is unavailable because of COVID-19. In case you're wondering, child care provider, there is a definition for that. It actually means a paid child care provider. So if it's grandma or grandpa providing child care, that is not a reason for the person to take leave. It has to be a paid child care provider. And then the sixth category is another we don't know. We don't know what those the other conditions will be that may be specified by the Secretary of Health and Human Services. We don't know what the sixth category is, but those are the 6 reasons that an employee can take the paid sick leave. Employees who are full-time get up to 80 hours. Basically, what you want to think about here is it's 2 weeks of leave. So a full-time employee is expected generally to work 80 hours, 40 and 40. However, if they work 50 hours a week, they're going to get 50 hours a week the first week and 30 hours of paid leave the second week. It's a cap of 80 hours. Part-time employees, basically, you're going to use whatever they work over an average 2-week period. If they have if they work at 20 hours every week, that makes it easy. If they're, retail, for example, you've got people who are working, different shifts every week. The burden is on the employer to do a 6-month average, so a 6-month look back, where you're going to calculate their average over a 6-month period, what they work average per week, and then do a 2-week period for paid leave. That is recognizably, and it can be a massive administrative burden, and that many of my clients are struggling with that because they have lots of part-time employees, and this is going to be very complicated for them to calculate. New employees, so let's just say you have an employee who just started, 2 months ago, there is no 6-month average. You just say, okay, look, what was the reasonable expectation of what this person was hired to do? So were they hired for 20 hours a week, or were they hired for 10 hours a week? So that's the total amount of leave that people are going to be entitled to under the first part, this paid sick leave. How you're going to calculate the rate of leave or the rate of pay when they're on leave for reasons 1 through 3, that is going to be their regular rate of pay. So if the person's subject to a legal order, if the person is self-quarantined or has been advised to self-quarantine, or if the person is symptomatic, they're going to get their regular rate of pay, their full rate of pay. If you have a person who's on commission and you're in the car sales business, you're going to use the average rate of pay, just like you would calculate for overtime. So that's a little bit complicated, and I don't want to drill down too much because it's a bit complicated, but get your payroll person to help, or get your have your employment counsel give you some guidance on that. In any event, you cannot do it as less than minimum wage. If it is the 4th or 5th reason, so if they are staying home because the husband caring for the wife who's in breast cancer treatment, or if it's because their child is home from school because the school is closed, they don't get full rate of pay, they get 2/3 of the regular rate of pay. And remember, that's for 2 weeks. There is a cap, there are caps on both categories, reasons 1 through 3 and 4 through 6. There's a max. So there's a maximum you have to pay them. Now, does that mean you can't pay them more? Absolutely, you can pay them more, but you will not be able to get the tax credits that I'm going to talk about only up to the cap. The tax credits are only going to go up to the cap. So if you pay them more gratuitously, that's wonderful and kind and excellent if you're able to do so, but you won't be eligible for reimbursement or a tax credit above these 2 caps. A couple other things that are just things to know procedurally for this part of the law. One is you cannot require the employee to look for coverage. So you can't say, if you're in retail, look, you can use this new paid sick leave, but you're going to have to find somebody to cover your shift. You may not do that. You also can allow the employee to use his or her PTO, but you can't require them to. So if they say, we don't want to take the paid leave yet, we want to use PTO first, that's fine. But you can't say you must use your accrued but unused PTO first. You have to let them decide. There is, for those who are forward thinking, there is no carryover from year to year, and there's no payout at termination or separation. So there's a cash value on the value of the paid leave. Department of Labor did announce this week that there is going to be a 30-day period of non-enforcement. That does not mean that you should wait 30 days to comply. It just means that you get a little bit of breathing room for 30 days, that there's not going to be, they're going to give you a little bit of slack. It does not mean you get 30-day waiver to not comply. And I will not spend any time on it, but bad things will happen if you get sued under the law, because it is an FLSA or a fair labor or wage claim. And that is one of the worst kinds of claims employers can have brought against them, because the potential for damages there is tremendous, as is the potential for attorney's fees. So don't get into trouble, just comply. The second part of the law, so that's a paid sick leave, 2 weeks. Remember, 2 weeks paid leave, either at 100% or at their regular rate up to the caps. Then you've got the emergency FMLA. I do these in this order, paid leave and FMLA, for a reason. So the reason is that eligible under the FMLA, eligible employees get up to 12 weeks. So paid leave is 2, FMLA is 12. Unlike the paid sick, which applies to every employee, even if it was just their first day of work, the new FMLA emergency expansion part requires that they have been employed for 30 days. Now, for those of you who are familiar with the FMLA, you're going to be saying, no, that's not right. The FMLA requires you to have been employed for at least 12 months, to have worked at least 1,250 hours in the past 12 months. Nope, that is not the case with this provision. So this does not, to be clear, this does not change the rules for the rest of the FMLA. So if you are 50 or more employees and you are subject to the FMLA, this is a standalone sort of provision. It goes with the FMLA, but it doesn't change. In other words, the FMLA does not now apply to anybody who's been employed for 30 days or more. Only this specific provision of the FMLA, this new expanded part. Just like before, healthcare providers and first responders may be exempted. Again, it's not the employer, that's by an employee basis. Why can
Molly,
they leave? Yes.
Let me have a quick question. What is the responsibility of the employer to make employees aware of FFCRA?
Yep, there is a notice requirement. The Department of Labor published a model notice yesterday. So that if you're asking that question, that means you're not on my mailing list, because I circulated that this morning. So email me and I'll make sure you get a copy of it. But it's on the Department of Labor's website now. Literally, it just went up yesterday. So, and the question about notice, usually you have to post it in a place that's conspicuous. Well, if you have an entirely remote workforce, that bulletin board in the break room is no longer a conspicuous place. So what you want to do is you want to email it to people, or post it on an intranet, or you put on an extranet if you have one, whatever way is going to be able for your employees to see it. If you are in construction, for example, and you still have job sites because you're an essential employer, essential business in the state of Delaware, and you're still operating, you're going to have to put it up on all those job sites. Does that answer it, Kevin?
Yes, thank you.
Sure thing. So with the expanded FMLA, there's only one reason for leave, and that is a very big reason, which is the schools are closed and your child is home from school or daycare. There was a lot of talk in the initial drafts of the bill about expanding the definition of child, so son or daughter. They did not expand it. So it's son or daughter. It has to be a person, son or daughter, who is under 18. So it's not grandchild. I get that a lot. It's not my brother's, my niece or nephew. It's only your child under 18, and it has to be because they are home from school or daycare because the facility has been closed. there's a question I will flag for you that if your employee says, I don't want my daycare is still open, but I don't want my child to go to daycare and I'm going to bring them home. At this point, it would not qualify as leave, but certainly the guidance may come out in the regs from the Department of Labor that may change, but recognize that this is a huge category of people who are going to be able to unable to work or telework because they have their son or daughter home from school. So that's why I do the paid leave first. The duration of the leave is up to 12 weeks. Now, if you're in Delaware and you have a child in public school in Delaware, you already know that we're talking about May 15th. So 12 weeks is probably going to be what they need. But the first 10 days are unpaid. Now, it says maybe unpaid, and the reason for that is twofold. One, you certainly can elect to pay them if you like. You will not get the tax credits for that I'm going to be talking about, but you can pay them gratuitously if you want. You can allow them to take their PTO. Again, you cannot require them to do so, but you can allow them to take accrued but unused PTO. I have some employers who want to advance PTO time, and that's fine too, absolutely. But the other thing you can remember is that the paid sick leave part of it, the first part that we discussed under the FLCRA, the paid sick leave is 2 weeks, which is intended to be these first 10 days. So in other words, you can overlap the two. You can have paid leave run immediately and start your FMLA at the same time. So they're running concurrently. And the first 10 days of the FMLA is going to be actually paid by that paid sick leave. So you can overlap them. That was not clear in the bill, but the Department of Labor has put some guidance out on that, you can run them concurrently so that people can get paid. So what that ends up looking like as the total package is 12 weeks of paid leave. There are different, again, levels of pay for this. The FMLA part is 2/3 of the regular rate. So it's not full rate of pay. Remember, it's going to be 2/3 of the regular rate for the number of hours normally worked, just like we talked about before. There is a cap on this as well. And the cap is important for this reason, the tax credits. So initially, the tax credits were going to be a 1-to-1 tax credit, meaning basically 100% reimbursement up to those caps that you would be able to get as an employer at the end of the quarter as a set off against your payroll taxes. Well, that was totally unsatisfactory to many people, many employers, because we have to wait a whole quarter and we're just getting ready to start this quarter, right? April is just now starting. So the quarter has not yet begun and employers were going, there's no way I can carry this cost and wait for reimbursement at the end of the quarter. So the IRS on Friday afternoon published guidance that said, look, we are going to give you a 1-to-1 tax credit right away. So before I talk about the specifics of the tax credit, let me just remind you that it applies to both types. So any kind of leave that you're giving, whether it's paid sick leave or whether it's the expanded FMLA under this new law, both of those are qualified for this tax credit. It also allows you to recover the costs that you are paying out to maintain employees' healthcare coverage during leave. This is hugely important. So when my clients are saying to me, what do I do? I can't afford to put all these people on leave, paid leave. There is some relief for you because you are going to be able to get the tax credit and you're going to be able to get it right now. So, and by right now, I basically mean per payroll cycle. So at the end of whether you pay payroll taxes, you have to deposit them, whether you're doing it monthly or semi-weekly. As soon as you would normally deposit your payroll taxes, you're going to be able to get a set off against those taxes for all the employees' share of the federal income tax that you're withholding, the employees' portion of the Social Security and Medicare taxes, but that is for all employees, right? So if you, I think it's an example here, if you have an employee who's paying, one employee who's getting $5,000 in sick leave total in the aggregate, normally you as the employer would be required to say you normally require $8,000 is your tax deposit that you have to make, whether semi-weekly or monthly. You get to set the $5,000 off against all of your employees' deposit, the payroll taxes you're collecting from all employees, not just for the person who's getting sick leave. So at the end of your payroll cycle on your next regular deposit date, you would be putting in 3,000. You would not be putting in 8,000 because the government's going to give you credit for the 5,000 that you've already spent. I do have a few slides on the essential employers, but I've really talked about them in the beginning. So, I'll just put these out there as a reminder. Don't record the results in the personnel file. Be aware of where you're doing them. Be aware of who you're doing them for temperature checks, but they are special exception right now under the ADA or the EEOC guidance. They are legally permissible. And here's that questionnaire that I was mentioning. You're also allowed to do this questionnaire instead of doing it when they're walking in the door. Of course, you don't want them to get into the workplace if they're having these issues. You absolutely require them. I have folks who are doing it via email every morning, requiring the employee before they report to work to confirm this questionnaire. Fine. You can do it on the phone. You can call folks on the phone and say, good morning, I need to confirm with you. This is your daily check-in. I need to confirm with you whether you have any of these things. I recognize that none of those is a perfect solution for every workplace. If you've got 300 employees that you're managing, you're not going to be making 300 phone calls a day. But just so you're aware that this is an option, which it was not prior to this pandemic. This is a special exception for this period because normally we're not allowed to ask medical inquiries. We're not allowed to make medical examinations of our employees. These are other questions that you want to ask if the employee has been in close contact with a person for confirmed COVID-19 infection. And for those folks who are here in Delaware, the Delaware Department of Public Health has published a sort of, I don't know if they're calling it a fact sheet, but basically it's a sort of fact sheet of what you can and cannot do. And these questionnaires are on there. So that's available online for you as well.
Molly, we had another question around if the employee's already exhausted 12 weeks from January through March of 2020, what do you do in the situation?
Okay, so it depends on what your policy says because you're going to need to know how you calculate your 12 weeks. I say most, but many employers do a look back period. So it's starting today, a rolling calendar, 12 months back. If that's you and the person has already, whatever your calendar is that you use to calculate, and that would be in your policy. If that's the case, they've already exhausted it. So you don't get to double dip or have a windfall on this. One other question, Kevin, that I'm getting from so many employers is what do we do about an employee who I have not had many who have tested positive. I've had many more who are symptomatic or who are concerned about whether they're symptomatic. All the privacy rules apply. You cannot give names without the individual's consent. And I understand that that makes it really complicated. So let's say you have let's say you have a little retail store and one of your employees goes home and is symptomatic, where you make that phone call in the morning and the employee says, hey, I'm symptomatic. Okay, you are going to want to consider, do you want to disclose that to other employees? You do not have a legal obligation to do so. The Department of Health or the CDC or whoever gets involved, if the person is positive, they will notify people. The healthcare providers have a duty to notify. Employers do not have a legal duty to notify. However, does that mean you don't want to notify? No, you absolutely might want to notify, but you cannot give the individual's name. So just like in a disability situation, if the person says, hey, why does Molly get an ergonomic chair? You don't get to say, well, Molly has a bad back. You get to say, because she got a new chair. So you're not going to give too much information, only as needed to know, and that is not going to be the name. I know that's complicated, but that's just the reality. Okay, that's all I got, folks. We do have a resource page on my firm's website that has tons of helpful resources, not just from an employment perspective, but also for those of you who might be federal contractors or dealing with contract questions. There's tons of guidance there. And if you want to get on my mailing list for near daily updates on what the legal landscape looks like and know what I'm doing in my free time, then you can email me and I will add you to the list.
Excellent. So we have a couple questions that came in throughout the presentations. One of them was from Bill Spenla. Whoops, I lost my question.
Oh, can I just jump on real quick? I see
Sure.
one of the questions, they say, do you mean Did I put the less or more sign the wrong direction? I totally did. Yeah. Yeah. So Simpson, you are correct. Thank you. I'm supposed to remember the alligator, aren't I? Isn't that the analogy? Sorry. This is what happens when you're working 24/7. I apologize. Yes, it is less than 50, fewer 50 employees. Absolutely. Yeah.
Okay.
Thanks for posting the link.
The other question was, what do we do in respect to succession planning if we have a senior leader that gets sick? And I think there's probably obviously both legal perspective on that as well as the HR perspective on that and operations. Like what is the plan for that type of activity? How do you handle that?
You know,
that's probably more of an HR. Yeah.
Yeah, okay. I was going to say, Kevin, I might jump in on that because we literally did that. So we have, given our size, we have a pretty robust talent process to begin with, which we do in June, July, and present to our board in August, and then we do an update. We updated, kind of had a special update in March, and we identified an emergency backup for every senior leader. And then we presented that to the board and have their approval. And so that's a documented plan that we keep on file.
Good. Excellent. Thank you. The other question I saw, and I'm not sure who asked it, I don't see it right now in my feed, but was with respect to providing mental health care for employees who are experiencing challenges, obviously, around coping with COVID-19. What are your organizations doing to help those employees?
Yeah, so I'll jump in. I answered that on the channel in case anyone's interested too. So we have an employee assistance program and a health advocate program, and they've both been sending out some great resources as far as even short videos or links to different organizations that are helping people in this high stress, high anxiety environment. It may not just be about the actual virus itself, but it may be having many people in your house all of a sudden and being around everyone 100% of the time with no break, or different things like that. So we've been sharing them with all of our employees and then posting them out on the resource page. So maybe someone doesn't feel, the anxiety and stress bubble up now, but maybe in a week from now, they're going to be looking for that. We've also forwarded out, our benefits broker had sent to us some great links for some different applications that are extending a lot of their free trial periods, letting employees know, hey, reminder, smart buyer beware, though there may be, a charge at the end of this, but different things like Headspace and Calm are offering some longer free trial periods. One of the things we were talking about is, whether we as an employer even wanted to pay for something in addition to that. I mean, we already have an employee assistance program that offers free counseling telephonically or in person, for a certain amount of sessions. But these are other places. Maybe someone feels more comfortable actually using, their mobile device, since that seems to be the next kind of up and coming app as far as doing a lot of the mental health counseling via the mobile app when it's most convenient for them. So we're just making sure to try and share a lot of those additional resources with employees as best as we can.
Excellent. Thank you. Thank you. So are there any other questions? I'm just going to close up here. If you have something you did not get a chance to ask, please go ahead and enter that into the chat at this point. But I would like to, a couple things we're going to acknowledge. We will send out a survey after this. That'll include some of the information that we shared today. This webinar has been recorded and will be housed on the Connect Delaware website under news. You can also find information there relating to some of the organizations in Delaware that have changed or pivoted in terms of helping the community, and that's really what this is about, is trying to find ways to focus on them. And also, obviously, if there are organizations that we don't have recognized there, please share those with us. There is a form you can fill out, and we'll make sure we're broadcasting that through our social media in helping Delaware businesses, small and large. Beyond there, I don't see anything new there, but thank you very much, Susan Kelliher, Susan McGarry, Molly DiBianca, for spending some time with us this morning on this great webinar and sharing your experience and guidance from your respective organizations, and certainly from a legislative perspective. I'd also like to thank Emma Palter, who is the brains behind a 7-day window to pull this webinar together. So thank you, Emma, who runs social media for Connect Delaware and ESC, and Stacy Connolly, who came in and helped out with moving questions back and forth. And Liz Allman, who has been very valuable to us in Connect Delaware. in terms of helping to come up with these ideas and helping some of the creation. So my team, thank you. Ladies, thank you very much for helping us with the webinar. If there are more questions, we will receive those through that survey, and hopefully we can do some more of these types of things in the future.
Perfect.
Thank you.
Thanks for
All right.
saying.
Be safe. Have a great day.
Take care.
Thank you.
Bye-bye.